Good morning, good afternoon, and good evening for everyone from the different parts of the world. My name is Halima Kholaiq, and I'm a second-year PhD student in Faculty of Medicine and Pharmacy of Casablanca, and I'm working on the severe viral infection. And our project is about COVID-19 disease in children hospitalized at the Pediatric COVID unit of P1, Ibn Rochd University Hospital Center of Casablanca. So my talk will be looked at under the following headings. As most of you know, coronavirus disease is an emergent infectious disease caused by SARS-CoV-2. Over 760 million confirmed cases of COVID-19 with more than 6 million deaths worldwide. The advanced age is the major epidemiological risk factor, and gender, comorbidities, and human genetic variants have been considered as a risk factor. But the hospitalization rates in COVID-19 is higher in men than in women. So children are very rarely hospitalized for COVID-19. The multisystemic inflammatory syndrome is also called pediatric multi-system inflammatory syndrome, is a significant and unexplained pediatric complication associated with SARS-CoV-2 infection, with incidence of 1 in 10,000 infected children. Typical symptoms including fever, abdominal pain, rich myocarditis, gastrointestinal symptoms, or cardiac dysfunction. For that, the understanding the epidemiology and clinical course of multisystem inflammatory syndrome in children and its association with COVID-19 is crucial. So our main objective of our study is about monitor the progression of COVID-19 disease in hospitalized children, including the development of complications such as pneumonia or multisystem inflammatory syndrome in children. The secondary objective was to identify any unique symptom or clinical presentation as specific to children. The aims was to describe the epidemio-clinical and evolutionary profile of COVID-19 in children hospitalized in the pediatric infectious disease departments. So to reach our objectives, we conducted a retrospective study from March 2019 to October 2021, and we recruited 131 hospitalized children from the Department of Pediatric Infectious Disease and Clinical Immunology. The analysis of the clinical and paraclinical data were collected from hospitalized record of patients with unstable children or children requiring isolation with positive COVID-19 PCR. Regarding the results, we found that the mean age was 5.3 years, and the most affected age group was 6 to 10 years old. The most frequent clinical signs of hospitalized children were fever in 96 rates, vomiting, diarrhea, dyspnea, nausea, headache, and 90 children were asymptomatic. The clinical presentation was made up of cases of isolated COVID-19 in 37% and COVID and comorbidities in 33%, but multisystem inflammatory syndrome in 30%. On the other hand, the lymphopenia was reported in 47%. 47% had children had positive C-reactive positive therapy, and 22% children had radiological abnormalities. The evolution was favorable with cure in 95% of cases, and 6 cases of deaths, including 5 with comorbidities, malignant non-Hodgkinian lymphomas, 1 primary immunodeficiency, and 2 bronchopulmonary dysplasia. So our finding demonstrates that respiratory-related comorbid PCR, positive PCR, and multisystemic inflammatory syndrome are the 3 aspects that cause SARS-CoV-2 infection in hospitalized children. Male sex is higher with a higher number of comorbidities, and misses initiate life prognosis. So to conclude, first of all, children fare very well with COVID-19 as compared to adults. Severe forms are possible, and inflammatory forms are frequent and severe. In addition, mortality is mainly related to comorbidities. So thank you for your attention, and thank you, Bioscience Initiative, for this wonderful event. Thank you.
Thank you very much for the great presentation. And indeed, children are, by definition, a vulnerable population that requires a lot of attention, although in many cases they are considered quite more, if not immune, at least capable of dealing with viral infections, including COVID-19. Did you observe in this cohort any cases of long COVID, apart from its grave manifestations that you have already described? Or is this cohort still under monitoring for the development of long COVID symptoms? Thank you.
No, we
Okay, well, that's absolutely very positive. And one more question before we move to the hot dogs. There are already some thoughts and some mentions in the literature that the MISC, so the progression of COVID, is quite similar to Kawasaki disease. Would you like to comment on this? In the sense that the hyperimmune response could also have similar futures or similar therapeutic approach with vasculitis that we usually see in the frame of Kawasaki disease?
Yes, the multisystemic inflammatory syndrome is similar to the Kawasaki disease. Like you know, it's an inflammatory disease. But despite extensive research, the pathogenesis of multisystemic inflammatory syndrome is remain incompletely understood. But some studies suggest that post-infection human dysregulation involve the incomplete for human response by T lymphocytes, leading to cytokine trauma and to production of various autoantibodies. That's it.